Hi, my name is Brenda, and today I will be discussing about coronavirus. According to Incubation Period and Coronavirus Disease 2019, published on May 31st, 2020, they claim that during this present time, there has been 3.7 million cases and more than 259,000 deaths. This was just recorded last month. The virus is causing the whole world to change completely. The virus is also responsible for a lot of health conditions as well. And it's our jobs as citizens to educate ourselves to make sure our friends and our families stay safe. According to the Problems versus Noblums on the Daily Beast, published on April 26, 2020, claim that Romania has had just over 10,000 positive cases, but has only carried out 115,000 tests, meaning a large part of the population probably is infected without even knowing. They also claim that asymptomatic carriers could easily spread the disease to thousands of people before a single case is even confirmed. This is extremely terrifying to know because you may not even have symptoms of coronavirus, have it, and spread it to everyone around you. This is a perfect example of how fastly this can spread. According to FT Health Coronavirus, A Time for Trade-Offs, published on March 4th, 2020, says that isolation treatment and other emergency health measures against COVID-19 may help defer fatalities among those most at risk, notably the elderly and those with fragile immune systems. Yet, many succumb to other conditions, including respiratory viruses. Not only will you may have to suffer with coronavirus and the symptoms that come with it, you may also put yourself at risk to developing another virus in the future. We don't even know what that virus may be looking like. It could be worse than the one that we're facing currently right now. In a big problem for the coronavirus economy, the internet does not take cash, published on March 25th, 2020, states that as the U.S. economy physically shuts down, access to digital payments is becoming a necessity. The internet economy does not take cash. This COVID-19 recession is bringing to the surface a long-standing divide over the cost and accessibility of digital payments. Bridging this divide is key to the response to this pandemic-induced recession. Due to this recession, large and small businesses are greatly affected. If they can't work from home, it's even worse for them, such as restaurants or fast food venues. A lot of people are losing their jobs due to this recession. Businesses are shutting down, and overall, our economy is just in a decline. But we have to realize that all of those aspects are outside of our control, and we can only control what we can. According to African Press Organization, published on April 29, 2020, they recommend that quarantine may therefore take place at home, if suitable, or at a designated non-clinical facility. Quarantine lasts 14 days. At the same time, self-quarantine at home is allowed as long as the quarantined individual complies with the quarantine regulations. Although this may apply just to travelers or those who may feel as if they've been affected with COVID-19, it is best to still follow the quarantine rules to ensure that you won't get the virus. In Health Coronavirus Prevention Tips, published on January 27th, 2020, provided a list of ways to keep yourself safe because there is no current vaccination for coronavirus. According to the source, they recommend to wash hands often with soap and water for at least 20 seconds, If soap and water are not available, use an alcoholic-based hand sanitizer. Avoid touching your eyes, nose, and mouth without unwashed hands. Avoid close contact with people who are sick. Stay home when you are sick. Cover your cough or sneeze with a tissue, then throw away the tissue in the trash. Clean and disinfect frequently touched objects and surfaces. This is great advice and tips for us to follow, and we should. Another precaution I take, specifically if I'm about to leave my house, is definitely with my car. I always wipe down my phone, my car handle, my steering wheel, and my steering gear, as well as my screen on my car. Anything I can touch, I just always wipe it down just to stay extra safe. Lastly, according to the Clinical Official Offer Guidance for Coronavirus Prevention, published on February 27, 2020, claims that if you are experiencing sickness or if you believe you may have been exposed, call the appointment line at 781-225-6789 and refrain from getting others sick by staying home and self-isolating. Supervisors have authority to allow members to stay home on quarters for up to 24 hours without medical visit. If you need immediate care, call 911 or go to the nearest emergency room. All in all, it's our jobs as citizens to keep ourselves safe and others around us safe as well. We need to follow these rules and take the tips and tricks that we have learned today in order to make sure that everybody stays safe. Thank you.